Go ahead.
Hi, we're going to do the extraction only facial, and we're going to get started. And then get the music for us. Okay, so how's your skin been doing?
It's been doing good. I have occasional flare-ups and stress. That's kind of it. Just, I guess these are what led me, because they're still under the skin and they just won't come up yet.
Oh, let's see. How often are those showing up?
These have been here, I want to say, since January. But they've gotten smaller, but if I try to extract, there's nothing that comes out.
Okay. So you're just kind of getting some inflammation. What about the checklist, like the lifestyle stuff? Do you feel like you're following that pretty closely, or?
Yeah, I'm not drinking as much water as I should, but I'm trying to eat gluten-free and not as much dairy.
What about pre-salted foods?
Nope.
Haven't been avoiding, or you have?
Oh, I have been, yeah.
Okay, good. So with your products, I think we need to add in the oxygen for sure.
The sunflower? I've been using that for the past week.
Oh, good. And are you losing any sleep with your stress?
I would say yes.
Okay.
I'm usually around like midnight I go to bed.
Are you getting 7 hours or more?
No. My kids are up at the crack of dawn.
So that's probably part of why there's some residual stuff coming up. So what I used first was the Lemongrass Cleanser, and then I took a little bit of Lemongrass Cleanser and mixed it with the vanilla soda, and that's what we're using as her disincrustation. And we're waiting for the steam here. We're going to steam her for a couple minutes. Sometimes I try to get my steamer going before my client even comes in the room. Then I'll point that steam on them if it's going while I'm cleansing, to start warming their skin up right away. So probably the only thing we could do better for you is be doing extractions more often, but because we're not in closer proximity, it's hard. But you're doing them at home, right?
I tried to. I haven't done any of these last couple of weeks.
She's an esthetician, by the way. Okay.
The last peel I did too is 2 weeks ago, because I knew I was coming here, so.
Yes.
Okay.
You can do it. So you mix in the vitamin
The C
uh-huh.
and B with the Manuka. And I do that once a week.
The triple blemish control?
The triple blemish control I have very tiny bit left.
Uh-huh.
So I was trying to save it till I got here.
Okay.
To get some more.
Are you using that twice a day?
No.
Aha. Okay. And so what are you using twice a day to moisturize?
I use the sunflower oil.
Okay. So we've got to switch you up big time.
Okay.
And that'll make a big difference. So the oil you should cycle on and off of.
Okay.
And that should be like on top of your triple blemish control at night. And then during the day, you could do the triple blemish control with sunscreen or the triple blemish control. Some people layer on peptides too.
Okay.
You know, to help with lots of things. Peptides are good for popping out, you know, any scarring or anything like that.
Mm-hmm.
And then also, what you're not getting from that triple blemish control is that's kind of like your bacteria killer, your exfoliant, and then the vitamin C is helping with redness and scarring and that kind of thing.
Mm-hmm.
So that needs to go on a lot as long as you're not peeling the few days around it.
Okay.
You know, like doing a pro peel.
Mm-hmm.
And that's one of the main serums that helps keep you clear. And then the Hungarian mud should go on if these areas that are having activity frequently, if those are acting up at all, you kind of want to get ahead of it where you're using that Hungarian mud 2 or 3 times a week, just for 5 to 7 minutes. You don't have to leave mud on long, which is really nice. But you're going to put a layer on all the areas that you might break out. Like say you miss sleep or something. You're going to potentially have some activity within a couple days.
Yeah, because I notice when my skin looks better some days than others.
Oh, well, that's normal because our body chemistry is constantly doing weird stuff that we're trying to keep up with. So I think between extractions and just a few little changes at home, that'll really help. Sometimes after cleansing, your hands might be sticky, so if they're really sticky, get a little tiny bit of powder. But I was drying my hands off so I can get into my gloves, or my gloves will stick to me and they won't go on. The Lemongrass Cleanser has the ability to leave a little bit of something on there so that your hands might get sticky. My light was swinging there by my client's head. Just don't knock out your client. You're good. So normally before I do that, I put the goggles on. These are tanning goggles, and these block out a lot more light, more than any you know, butterfly cover or that kind of thing could. And it'll go away after. So partially that's why vitamin C is so good when people have breakouts, because it actually, get in there a little closer. So when people have breakouts, their capillaries, need help. The capillary walls need help staying stronger. This one's a perfect example. This is bruised under there, so there's a capillary under there that's burst already, and trying to mess with that without a lancet there's potential that it may just aggravate her skin right there. This one, on the other hand, is not doing that, but these are kind of cystic, so she needs to also ice. If she ices often, those will kind of just shrink back down into the skin and go away. So what I'm doing now is I'm going back and checking some of the sites where I extracted and making sure we can't get any more to extract here. What I would love for these is a lancet. So all this stuff needs to come out too on acne people, because this little stuff will turn into big stuff later. And people were asking me on my last videos, how can it come out so easy? And when you use this method correctly, it all does come out this fast and easy. That's what you're seeing on here. So I thought that was kind of funny. I had a few comments and people go, it's not possible to extract that fast, but yes it is. So this one is kind of networked together here. So this is also, if you look right here, this has got a capillary that's damaged to you about. Once this opens up, if it wants to, it's probably going to be a bleeding spot. Let's see. Got it? Okay, so this too had a little capillary action inside of it already. So you can see now that's releasing a little bit of blood. And you know, when you're doing acne cases, you just can't be afraid of that, because these capillaries are already doing that underneath the surface. So, you know, just let it drain, try to keep it flowing out of the area so that it doesn't get a whole bunch trapped under the surface, and you'll be good. She's really pretty clear. We're just working on all of the coloration. The discoloration still, you know, when you get scars of any kind, it takes a little while for them to lighten up. Expecting them to be gone in 4 weeks is not not what's going to happen. So as that came up to the surface, you could see there was a little blood that peeped out. It's really common after you extract something to see some blood at the very end. Are you getting close-ups on these?
Mm-hmm.
Pause for a second. Ready?
Mm-hmm.
Okay. So we finally got this guy to give it up here. So this had a lot of fluid and blood, and already it actually looks better now that I'm draining it, and I really didn't use a lot of pressure. I was able to get, by brushing the top a little bit, I was able to get one of the sites here to open up. And this was one that was more noticeable that I'm sure she wanted gone. So you can see all that blood just came out and it cleared out of the way. And excuse me. Just swapped my wipe out there because it was getting a little bit full of stuff. And this probably feels relieved to her. Does that feel better than it did when we started?
Mm-hmm.
Yeah, so those are full of a lot of pressure. You can see, even though there's a pretty angry capillary or capillary system under there, this emptied out and then it's kind of looking better already. So that's the goal. And you can see these little spots that were bleeding a little bit, they're not filling up under the surface. And that little bit that's on the very surface, that's going to be gone in days. It really won't look like it does during the time of extractions. Eye pressure okay right here?
Mm-hmm.
Okay, see, this is almost completely flat. We didn't anger that capillary any more than it already was. And this is going to keep draining a little bit even as we do the rest of the facial. So, that was kind of the biggie. The other stuff's really minor. It's just probably from a little bit of product usage switch that we need. And okay, so when her skin's relaxed, you don't see anything. The minute you spread it apart, you can see here these little bumps, and these gotta go. So these will hide if you don't know what you're looking for. You've got to spread the skin apart. Now watch, these will just come right out for the most part. That one, let's see. And this little stuff, if her skin gets aggravated, this stuff will turn into bigger stuff. So this has all got to go. Now I'm using the round part of my tool. Okay, I don't show, people ask all the time, what are you doing? Are you using the sharp edge? Are you using the hole? I'm using this area right here. This is the round part of the tool. Don't use the sharp parts of the tool. That's why loops, this isn't even one of the mean loops, but that's why these edges are very sharp on a lot of the loops, and that's why they kind of cut into the skin and they do more damage potentially than this method. So there we go, a little bit came out. You can come closer. Okay, and here. So this is good because she's got a blackhead, some blackhead spots, and also acne extractions. Let me clean off my tool so you can watch new stuff collect here. There it is. Are you sleeping on this side, maybe? Mm-hmm. Yes, I have seen so many things over the years. A lot of times I can tell what people are doing before they tell me. Just by the way the extractions look. So this one collected a little something under the surface. So now that it's kind of dry, we'll see if we can't get that to move without making it angry. Otherwise, the oxygen will move this little bit of blood out of that area really fast in her home care. Okay, so this was all purple all on its own before I started, and now look, you know, it's looking a lot better color just getting that liquid and pressure out of there. And if you're doing heavy-duty extractions, you might want to wear a facial mask if you kind of get your face down in it, because stuff goes flying sometimes. That one did go flying. Okay, this is the other one that was down in this area. And I was able to get a little of the dead skin off the top. And now it's going to give it up. So we want these nodules, these really inflamed cystic things. You don't want them sitting. They'll literally sit there forever, right? Mm-hmm. You can't get them out. They sit. It's no fun. Okay, so we took a little more time than I normally would because we had to film all that, and these are still draining, so they drain after you do the service. Okay. So because there's a little bit of blood, I'm going to leave my gloves on now. We're going to put So remember, you have to sanitize every bottle and everything you touch for each person, but as long as what you're using is cleaned for each client, you're doing your services safely. So we're going to do her peel. And I believe with a couple little tweaks, her skin is not going to have quite as many little breakthrough guys showing up. But if she continues not to get enough sleep, then she will get one or two that she can't avoid. That's how it works. So let's see. You may use a brush, or we use 2x2s. I'm going to show you some techniques on the peel today because her skin's well acclimated to this, and we're working on certain areas, reducing redness and that kind of thing. Normally I would start on the forehead, but because my focal point with her are these areas, we're going to start there. So it's there on her skin, those areas the longest. Now, there's a lot of companies that have these self-neutralizing peels, and technically our peel is one of those. If you leave it on, it'll neutralize itself, but peels can become reactivated if people sweat, or even if they say they're self-neutralizing. I always recommend wiping them off with a little bit of distilled water, unless you really know your client well. How strong is that feeling on a scale of 1 to 10 so far?
It was a 2, but then it's
going down.
Yeah, just because from the extractions.
Just the extraction sites are tingly?
Yeah. Mm-hmm.
Okay. So this is the 30% Mandelic Peel. Now, the way to get it deeper without going to a higher percentage is to massage it in to certain areas. And I'm actually going to take a little of the fruit acid blend, a different type of peel. And we've gotten her base on as Mandelic, and we're going to take more of this and we're going to work on the scarring area. And we're going to see if we can't get her tingling. So this is how you up the ante, you know, with people you've been working on for a little while. How's that feeling now, massaging it?
Can feel a little tingle. Can feel it getting warm.
So we'll give it a second and see if she doesn't start feeling more of a tingle. So you can layer peels on and you can treat certain areas. And any swelling you see from the extraction sites is just histamine. Very normal. Did that bring those areas up to a 2 yet?
Almost.
So we're going to try and keep layering until we can get her to feel something. That's how you know by their numbers, that's how you know how strong it is. How's that feeling?
It's not so much tingly, but I can feel the warmth from it.
Mm-hmm. Do you have a high pain tolerance too?
No.
Okay. So in this case, because she's not feeling at least a 2, we're going to keep massaging these areas while this peels on. Now this could be real tricky doing this on somebody who's feeling something. Do not do this unless you know what you're doing and who you're working with. How about now? Still the same?
Yeah, it's still the same. I can feel it tingling when you put it on, but then it just subsides.
Okay. So my goal with this is to get her to peel a tiny bit. It won't necessarily be super noticeable if she's moisturizing well, but and you can see the blood is coming up to the surface, which is normal, especially with the Mandelic. Not much, just the very tips of her cheeks. So you take clean water when you're ready and get a little peel down here. I go all the way down, if you can zoom out and show everything. I go all the way down to the décolleté or down to the chest. That's what you need to get with your peels. Any tingling? Just kind of the same?
It's staying warm.
Okay. So the rest of her face needs a little bit of peel, but we're doing a treatment in this area. And the rest of her face doesn't need to be massaged like that. So I do one wipe down with one side of my wipes. Then I'm flipping my wipes over, okay? So there's no peel on this part of the wipe. Then you wipe again to get all that peel kind of neutralized. Did that take a lot of the action that you were feeling away?
Mm-hmm.
Also, all of the acids we use in our peels are, so before I get on to that, what we need to do now, this is the 10% ozonated oil. Now, even though oils block what goes on top of them a little bit, they also restore the barrier. And on almost everybody, I'm going to put down a layer of oil. Now you can see there's more action where we massaged it into her skin. So even though she wasn't feeling a lot, you've got to be careful and not go over that certain amount of minutes. And you know, you got to watch people very closely when you're doing peels. So also oils can make the skin feel a little bit warmer too, because they sort of restore the barrier and lock in a little bit of the warmth that she's feeling. And then we're going to try and put some of the Aloe cucumber mask. This mask is loose enough, it'll usually just pour out. There's not a lot left in here. But this is to give me a little more slip to do a cool down with cold stones. Does this tingle at all? Or feel cool?
Feels a little cool.
Some people, their skin, their barrier is so sensitive at this point after a peel that if you put that aloe even on top of a layer of oil, and that was an acne safe oil, they're gonna feel it.
I can feel a little in my cheeks now.
Yeah, they might feel a little stinging and a little tingling, but her skin actually is looking less flushed with that aloe on there. So a nice cold stone, cool down, make sure you sanitize your stones with Cavicide as well, because you're massaging over stuff that's draining. Is that taking the heat down?
Mm-hmm.
So this is more of a complete facial treatment excluding massage. This is our essential facial. This just excludes massage, and we call it the extraction only facial. Oop. So these will get super slippery, and because I'm wearing gloves. So what I just did is I rotated the edges of the stones. So the new edge is cold, right?
Mm-hmm.
It feels better to rotate them. Now after this, all she's going to need is a little shot of Hungarian mud put on her cheeks. And Hungarian mud can be ever so slightly drying, so you need to cut the dry part of it and cut the action of it a little bit with a layer of oil after you peel. So her skin getting a little flushed too is very good exercise for her capillaries. It's flushing out all the toxins, and it's bringing fresh blood up into her capillaries, and that's going to flush out all the toxins in that area and help her skin look really healthy over the next couple days. So sometimes what I do too when I'm working is the stuff I've touched and I've used that's contaminated, I put it kind of in a weird spot for a minute on my cart, so I know at the end of my treatment what I touched and what I need to clean. I kind of move it up to my SMA. So now we put on the Hungarian mud and we let it sit. We're running low on our biggie jar. Now you have to mix this up before you turn this on, or I mean put it on. And sorry to, normally I wouldn't mix right by their head. It's not a nice sound. So we put a thin layer especially when we're layering on top of other things, but you have to keep it simple after a peel. You can't put a bunch of real active serums and creams. Cream will make someone blow up after a peel. I stick to a lot of hyaluronic and ozonated oils, which is also a secondary oxygen treatment, and I keep it neutral. And I do a lot of professional exfoliation because it's something clients can't do at home. So cover the entire problem area. And wasn't your forehead had some action before too, but now it's kind of clear, right?
Mm-hmm.
So her forehead is doing really good. Her cheeks are just, and jawline are just the most challenging part. So, just like I said, it's 5 to 7 minutes now. If you've run out of time in your facial, just do 5 minutes. Alright, so what I'm going to do before I do the warm towel is get the bulk of the mud off. Mud is very hard to get off, so you're going to see me catch most of it with these wipes, but if it gets on anything, It's not coming off. So, if I didn't have my gloves on right now, this would also be all over me. I've gotten it under my fingernails before. Looked like I was out in the garden digging all day. So don't make this towel too hot. Hot is not good after all the peeling and extractions. So I'm cooling the towel down. You open it up and wave it. And then on the very inside of your wrist where you've cleaned your hands, you can check the temperature. Then ask your client, does that feel warm but not too hot?
Mm-hmm.
So don't hit them for very long with this hot towel. And some people, if their skin's looking overly excited from the peel, I do not use any heat. So her skin was at one of the lower levels of feeling something going on. So the little bit of heat is fine. But you can see now where her cheeks were a bit flushed. Everything's kind of going down, and when she stands up, that'll be gone pretty quickly. Now, like I said, oops, gotta watch out, that mud goes everywhere. So we're gonna do this toner hyaluronic. The hyaluronic goes around their eyes too as the eye treatment. Hyaluronic, then ozonated oil. I'm going to use the 100% on her. Now the 100% has a smell, so make sure people aren't just crazy turned off by the oxygen smell. A lot of people love the smell, but it's potent, you know, it's a real treatment. So, so this is sticky, so you gotta apply some toner to your fingertips to get it to spread everywhere. Then you're going to put on her sunscreen. This is our old version, but we're going to have a new serum, and we're going to also have a cream that are totally safe for all skin types, including acne to dry. The dry people should just probably use the cream version. And it'll be zinc and titanium based daily defense that we'll have very soon. Make sure if you've got something like this, your client doesn't have a fruit allergy. We actually just got these little cherry chapstick kind of things. But this is a nice gloss that has a tiny bit of color. Not too much though. Okay, then you check the edges of their hairline. Make sure it's not looking crazy. And that's it. Thank you. See you next time.